Okay, everybody, thank you for joining us this morning. I'm Bob Kroll and the coordinator of the Cannon Beach Disaster Animal Response Team. Hopefully most of you know what that is, but we've invited people from further afield than just Cannon Beach. So the DART team is one of the emergency prep volunteer groups in Cannon Beach, along with CERT and MRC. And thank you for being here. I'd like to introduce my friend and colleague, Dr. Bob Mack. Bob is from Syracuse, New York, got his bachelor's degree at Syracuse University, graduated from veterinary school at the University of California, Davis, did an internship at the Animal Medical Center in New York, which is a really serious level killer internship. And then went back to UC Davis to do his internal medicine residency. He's board certified in veterinary internal medicine. I met Bob when I first moved to Portland in 1992. He was working with a friend of mine, and in 2001, after they, maybe 2000, after they built a beautiful practice called Northwest Veterinary Specialists, he hired me to join the team. So I worked with Bob for 18 years. Anyway, I've asked Bob to speak to us about first aid and CPR for dogs and cats. And I've got two more people to admit. And then we can get started. Okay, I will ask if everybody, probably most people are, but if you can mute your microphones, and if you have questions, you can either raise your hand, type them in the chat box. I'll try to keep an eye out, but certainly if you're compelled to, you can unmute and ask the question. Okay, Bob, I'll let you go. I'll mute my microphone. Thanks.
All right. Can everybody hear me okay? Okay. Well, thank you all for taking time on your Saturday morning for this lecture. This is a lecture that actually was produced by some of the folks at VCA, Northwest Veterinary Specialists, and it's a pretty comprehensive list of emergency first aid and CPR course. I've given this lecture at the Oregon Humane Society a number of times, and Bob gave a pretty similar lecture a couple of years ago for your group, so it may be a little review for some of you if you were at that lecture. Otherwise, but still a very good review, and it's pretty comprehensive. I've got about 100 slides here, so I'm going to try to move, fairly quickly, but I also want to make sure that we keep this pretty nonchalant. And if you have questions, we'll certainly try to answer those. So, so why first aid? Well, emergencies can happen anywhere and anytime. We always have to be somewhat prepared for the unexpected. And I think that's so much more true now, it seems like, with global warming and the fire situation, and just so many different changes that are going on here. It's even more important that we try to do a little preventative procedures to be prepared to deal with emergencies if they happen. Of course, the big problem we're having now, besides these areas of flooding and in different storms and the risk of earthquake, is the fire situation. Maybe not so important for Cannon Beach, but you've got a lot of woods around you as well. And last year I got evacuated from my house here because of a fire here in Oregon City. So just got to be prepared. It's probably important, I don't know the veterinarians in Cannon Beach area, but that you get a pretty good working relationship with your veterinarian so that they know you, know your pet, and that you follow some good preventative medicine for preventative health care plans that you and your veterinarian work out that works well for you. So just try to make sure, if you don't have a veterinarian, I would probably try to get established with one, especially now since veterinarians are so overbooked it's hard to get in to see one in any kind of time. You're going to have a much better chance if you're already a client of that veterinarian to get in sooner than later. I think for everyone, especially if you have dogs, outdoor dogs, or even if you have cats that might have a tendency to be escape from being indoors, to have some sort of tag with them. Usually I would probably have your name, your number, how you can be reached with the name of the pet on there. You can have the veterinarian's name. Sometimes if you have pet insurance, like I have a Trempanion, they will also give you a identification tag. And if people find your pet, they can call Trempanion and they will contact you as well. Microchips are pretty easy to administer, and they also help to identify your pet if it should get lost. So we always look at and try to check for microchips in any dog that is presented to our hospital with a known origin, you know, if somebody just found them a stray dog or so, and that is really quite helpful to making sure your dog gets back to you in a safe manner. I think it's important, without trying to make you be veterinarians or anything, but you can do a lot with the physical exam just on your own. And I think the power of observation is probably the most important. You know your pet better than anyone. So you know if they're acting differently, that there may be something not right or going on. But it's pretty easy to at least do a fairly physical exam on your pet. And you want to try to listen to their heart rate if you can, their respiratory rate. I don't know that you need to necessarily get a stethoscope, but having a stethoscope is certainly not a bad idea, especially if any of you have horses, because if they're colicking, sometimes heart rate is very, very important. My wife is an equine veterinarian. That's one of the first things that she always asks her clients when they call is, what is the heart rate? You can tell the heart rate also by feeling the femoral pulse and so forth. Looking at just their overall demeanor, their appetite, the water intake. Are they defecating normally? Are they eating normally? Are they losing weight? Things like that are vital just signs that maybe something is wrong with your pet if those are not normal. So some parameters, just to give you an idea, is that if you lift the lip of your pet's lip there, if you lift it up and you press on the gum, hopefully the gum is pink, and you let go, it should refill that pink color in about less than 1 second. And again, it should be fairly pink. Now, sometimes there's pigmentation in there and that makes it difficult, but for most cases, you can do that. If you have a thermometer, which I would recommend that you have, a temperature should be, for dogs and cats generally, is about 100 to 102 degrees. And for heart rate, normal is about 80 to 120. That can vary depending on whether they're exercising. Cats is usually more around 180 to 200. Respiratory rates, again, for both dogs and cats, is about 15 to 30 breaths per minute. Now, when your dog is breathing, there should be normal chest wall expansion in and out with minimal effort. Now, if they're panting, of course, that's different if they're exercising. But if you see signs of a respiratory distress, which can include if they're holding their necks out and having loud, unusual airway sounds like that type of noise, if their elbows are out to the side, and certainly if their respiratory rate is significantly increased when they're not panting, that is another sign that there may be some respiratory distress. Now, in cats, you should never see cats, or it's always a concern if cats are open mouth breathing. Not so much for dogs who pant, but cats usually do not breathe with their mouth open. That usually indicates there is either severe stress or that there may be some sort of pulmonary or cardiac issue or problem. Again, stress sometimes can do that by itself, but it's a warning sign. Whenever we see a cat that comes into the hospital that's open mouth breathing, we handle that cat with kid gloves, because they can be very, very much on the edge of going into respiratory arrest if we try to stress them out any further or do too much with them too quickly. Again, here's lifting the lip. You can see the pink color. You press on that, it should blanch. And then when you lift your finger off, it should refill with that pink color. And you can see down in this lower right picture, an animal who does not have that pink color. So that suggests that there's a major problem there, either with blood flow or shock or something along those lines. Again, a stethoscope can be very helpful. You can also feel a femoral pulse, which is in the upper right-hand corner, and count, for a minute or 20 seconds and multiply the number by 3 to get a heart rate. Again, I think everyone should have a rectal thermometer at home. Don't do what my kids do and label the dogs one for dad, but get one for your personal pets. And not always easy to get a cat temperature, but sometimes you need help doing that. But a little petroleum jelly or something along those lines. The digital thermometers work pretty well. And again, it only takes not very long to get that. Just place that in rectally, and you can, when it beeps, you can get the temperature. There are other ways to take temperatures. I don't think they're quite as accurate as from like an ear or so forth, but I think the digital rectal thermometers are probably the best to have handy in your emergency kit. All right, so for the nervous system, and this is Bob's area, obviously being a neurologist, but I think the main thing is to see, is your pet alert? Is it appropriate? Again, you know your pet better than anyone. You know their behavioral patterns and so forth. Changes in mental status can be due to any number of different things, including seizures or toxicity. And if you think that your dog is alert but is having problems maybe in the legs or from what we call the neck down, they may have generalized weakness, and that may indicate some sort of disc problem or any number of different things. These are things that probably need to be seen fairly quickly, because especially, for instance, in our little dachshunds down there who are prone to disc disease and protrusions, getting them evaluated, and if they have a problem, getting that fixed probably improves their prognosis from returning normal neuroactivity. So again, when I was an intern, my neurologist asked me to, in front of everybody, to do a neurologic exam on an animal that we had in the center of the room. And I got up to go and do it. And he said, "No, I don't want you to touch the animal." And his point was, I've never forgotten it. His point was you can tell an awful lot about neurologic situation just by observation. Are their pupils normal size and shape? Do they blink? Can they walk? What's their mental status? So it was a lesson that I learned, that the power of observation is probably one of the most important things we can do. And usually the physical exam for us is probably the most important item we can do as far as diagnostics that help us to hone in on what's wrong. Okay, palpating the abdomen can be very difficult, especially if the animal's a little overweight, like my golden retriever, which is not this one. But you can assess the abdomen to see if it feels like it's uncomfortable. Do you feel that it's more distended than normal? It might indicate that there's some fluid buildup. We also note that we'll talk about this a little later, dogs who get what we call bloat or dilatation that can be a very serious problem. Note any kind of resistance or vocalization that may include that they're having discomfort. If there is, I think this is something where, again, getting them evaluated by a veterinarian as soon as possible is probably in their best interest. But again, there's things you can do at home to assess that. And also, if you call your veterinarian, they're going to ask these questions too. So the more information you can provide your veterinarian over the phone, perhaps the better they can determine whether they need to be seen right away or if this is an emergency or not. The integument skin, I think mainly that's just looking for signs of issues, hair loss, fleas, of course, but also looking for any kind of trauma that might be there, lacerations. If there's air underneath the skin, which we can sometimes see with problem if they've got a rent in their trachea or airways. You sometimes will have what they call subcutaneous emphysema, and it kind of like Rice Krispies kind of makes these crackle sounds. Pretty uncommon, but still something to assess or look for. So hydration is certainly a critical area that we need to address, especially in working dogs. And trying to assess if they're hydrated is very important, especially in times of a real heat wave like we had this past summer. And one way you can kind of get a general assessment is to pick up the skin and then let it go. It should bounce back. It should have some ability to bounce back. If it stays tented up, it may indicate that your dog is moderately dehydrated. Again, if there's been a history of something that might have caused that dehydration, being in the car too long, being on a hike, not access to water. Those are just some of the things that can cause dehydration. Vomiting, diarrhea as well. Again, the pupils, you can look at those. They should be equal in size. They should respond to light. You can just get a little pen light and check. When you shine the light in, the pupils should constrict. Both should constrict. You can look at the white, what they call the sclera. It should be fairly white. It shouldn't be red or discolored. If you see, I take eye issues pretty seriously, because if you get them in to see a veterinarian, if there is an eye problem soon or quickly, sometimes that can make a big difference about saving eyesight, especially if there's ulcers there, because you don't want an ulcer to rupture. But if you see squinting, excessive blinking, or if the pupils don't seem to be equal, and there can be reasons why that can occur that can be benign. We call that iris atrophy in older dogs. But still, if you're seeing blood around the area of the pupil or the sclera, or if they're having any kind of signs of visual problems, these, I think, really should be seen by your veterinarian pretty quickly. You want to try to get the eyes evaluated and treated, because obviously it's blindness is a potential possibility that could maybe be prevented with proper treatment and diagnosis. All right, let's talk a little bit about safety. If this is just a little slide about how to potentially muzzle a dog, and this is mainly, I think, something to think about if you come across an animal that has been injured or a stray dog. Be very careful. If you don't know this animal, and certainly if they're injured, they may be the nicest dog in the world, but if they're painful and they don't know you, or even if they do know you, even if you're the owner, they may bite because they're scared and they're in stress and they're hurt and they're painful. So this is just one way that you can try to do this with a gauze. Again, be very, very cautious about trying to get that around, because they can be pretty quick. The veterinarians have very good reflexes for that reason. And again, it's probably best to tie that around the back of the head, and that just sort of takes away their main way that they can hurt you until you can get them to appropriate care. Again, you want to be very careful when you approach an injured dog, and if you're restraining them, I personally like the picture on the upper left where you kind of hold their head down, because that's the area that can hurt you, their mouth, and lift by putting your elbow there on their neck. You can kind of prevent them from being able to lift their head or get up, and then using your left arm to kind of, again, hold down their body and hold their paw, their leg there, so that, again, that you're restraining them. Not something that you guys probably will need to do too often, but it's just, again, I can't stress enough, if you approach a dog who's been injured, you've got to also make sure you do not get hurt in the process as well, and try to get help as quick as possible. For cats, I'll tell you what, cats are more difficult. They can cause severe damage, not just with biting, but with their claws as well. So oftentimes, if we don't have a crate or so, and muzzles are not very easy to put on a cat, we usually just put them in a burrito wrap. And the best thing to do is a towel that wraps around them kind of tight. It kind of prevents them from being able, you can hold that towel and they can't quite reach around and grab you or bite you. And if you need to transport them, you can do that. You can also try to get them into a carrier, but that is not always easy. And again, take big precaution with an injured cat, because again, they can really cause some damage to you. We see people who get bit all the time, even by their own cats under certain circumstances. And again, it can be prevented most of the time if you just take some precaution and immobilize them as best you can. Of course, for transport, you know, we don't always have the ability to have emergency people right there at the time. My only saying here probably would be, if you think your dog has neurologic disease, can't walk or so, and you need to get them to a veterinarian, try to move, just like people who have maybe spinal injuries, like football players or so forth. You want to try to transport them without, you know, really moving them any more than possible. You don't want them to exacerbate if there's a disc or something protruding. So just try to keep them calm, quiet, and get them to a veterinarian with as minimal movement as possible. Now, if they're injured from a leg or fracture or laceration or hit by car, that may be a little different. But if you think there's neurologic, you don't want to excessively move that dog or cat, because again, it might cause further damage to the neurosystem. All right, so triage, that's something that we have to do at the emergency clinic all the time, just like they do in human medicine. And they have different classes, and class 1 is the most important. These are dogs with immediate and life-threatening problems. They're severe trauma, they're in shock, they're septic, which means they have bacteria flowing in through their bloodstream. They're having trouble breathing, like smoke inhalation, or they've got some sort of obstruction. There's active bleeding going on that is causing shock, or they are unconscious. And so these animals need to be seen right away. They take highest priority because they are the most critical at the time. Class 2, these patients also have critical injuries, and if they are not treated within a reasonable time, usually an hour or so, they can become unstable. And these would include animals that have major fractures that might cause bleeding, because you can get bleeding from severe fractures, especially some of your major bones like your femur. They have multiple injuries, chemical or toxic exposure or ingestion, but they need to be seen pretty quickly, but they're not quite as urgent as the class 1. Class 3, these patients have serious injuries, but they're more stable, and they can probably be treated within a few hours. And some of these, even though fractures look very, very severe, sometimes they can be just immobilized a little bit and covered with a bandage until you can get to them a little bit later, again, depending on your situation and how many other animals you have in the ER and their state. So these can wait, but you still want to get to them within a few hours to stabilize them. Class 4, again, these are injuries that should be seen within, taken care of within 24 hours. But, I think the key thing here for veterinarians is that even if an animal comes in and we classify class 3 or class 4, you have to pay attention to that, because their situation can change quickly they can change from a class 3 to a class 2 or even to a class 1. So if it's your pet, you need to monitor them very carefully, even if they seem stable and you can't get in to see a veterinarian for an hour or two. Watch them very carefully, because if their status seems to deteriorate, that is a reason that you need to get them in sooner. Even if you don't have the appointment, they need to be seen right away, because that can be very critical for their prognosis. So the emergent physical exam, again, some of the things that you want to look at is the pet breathing? If you can feel the femoral pulse, do you feel a pulse? Now, that's not always easy to feel if you haven't done it, but I would suggest you try practicing on your own dog or cat, just so you're comfortable knowing how to feel a pulse and how to attain a heart rate. Of course, is the pet unconscious or unresponsive? If any of these are happening, the pet is not breathing, does not have a pulse, is not conscious or responsive, they need to be seen as quickly as possible. It's going to be very difficult for you at home to do much in terms of resuscitation other than we'll talk about CPR, but you need to get them into a veterinarian or emergency clinic or an urgent care facility as quickly as possible. So let's talk a little bit about cardiopulmonary resuscitation. And it seems like the recommendations for this change continuously from when I first started practicing until now. The main focus, the new kind of criteria is that you really focus more on chest compressions, and they're talking about 100 per minute. So that's more than 1 per second. It's almost not quite 2 per second chest compressions, and uninterrupted. Now to do that, and we were normally hoping to have if we did this live down in Cannon Beach, we were hoping to bring in some animals or a dummy to kind of go over this, but we just have to talk about it. The dog, if he's unresponsive, generally they are, if they're not breathing or if they don't have a heart rate, you want to lie them on their right side. And for medium to large dogs, a chest compressor's hand should be placed over the widest part of the chest. One hand placed over the other in parallel. And you try to compress the chest down at a continuous, uninterrupted level, about roughly 30% of the chest wall in diameter. And again, it helps if you have 2 people, because this can get to be quite tiring. Not only that, but one wants to concentrate on the compressions, and the other person can then concentrate maybe on breathing or monitoring or helping as best as possible, or calling the veterinarian to get let them know you're on your way there. The chest wall should completely recoil when you press down, and then we release. The chest wall should recoil back up to normal. You want to listen and see if you have any signs of breathing. If you get a heart rate back, or if they start breathing on their own and with a heart rate, then you might need to monitor them and see if they have recovered, but be very, very careful, because they can rearrest again. However, if they're not breathing, you can give 2 forceful breaths by putting your hands around the muzzle and give 2 breaths. You want to see that chest expand, hopefully. And then you want to try to give about 2 snout to mouth breaths per 30 chest compressions. So if you're doing 100 per minute, roughly, that's about every 20 seconds or so. You want to give two breaths, kind of as shown here in the picture. Again, it's a very difficult thing and very stressful when an animal's in cardiopulmonary resuscitation. Just try to stay calm, try to do the best you can, and monitor them to see if they start breathing or if their heart rate is also back being present. If the patient is not responding, of course, you need to try to get them to you should try to get them to an emergency hospital or a veterinarian or urgent care, even if they respond. And the reason for that is that sometimes they will re-arrest or lose their heart rate. There's a reason why they had this happen, and you need to maybe treat that underlying problem. We sometimes see this with dogs that have had anesthesia reactions or other issues, again, not in your case, but or if they have trauma or something along those lines, but there may be a reason why they went into arrest, and you need to try to address that as best you can too. And really monitor, even if they respond, to reoccurrence of cardiopulmonary arrest. But again, get them in as soon as possible, be evaluated and observed in a facility where they can also have the ability to give oxygen and so forth if they should rearrest again. A little bit about surgical emergencies. And this is more for what you can do at home. If you have a major laceration or a trauma to a paw, a bite wound, things that you can do before you get them into a veterinarian is just if the animal will allow you to do it. And again, this goes back to being very, very careful, because they can be in a severe amount of pain and can be fairly aggressive, especially some of these cats. But try to clean the wound as best you can from dirt, any debris, and the area around the room the wound rather. You can use warm water to rinse the wound area. You can try to pat the area dry. I would not apply a lot of medications there or anything along those lines. The main thing you want to do is try to prevent further damage, but soaking the wound or paw in this case, and cleaning the dirt and debris until you can get them in to be seen is a reasonable thing. You could put a little protective bandage on it, but that's a two-edged sword. We'll talk about that a little bit in a few minutes here. So if you have, when do you need to see a veterinarian? Not all wounds necessarily need to see them, but if there's a full thickness skin or gaping wound, it probably needs sutures, just like what we would assess in our own situation if we had a wound. Well, do I think this needs sutures? I better get in and be seen. Or certainly if you see signs of infection, that would be another reason for having that wound evaluated, and a more aggressive treatment may be needed. Again, some of these wounds can just be cleaned and flushed, and you may not have clippers. If you do have clippers, you could try to remove some of the hair around the wound while you're trying to get them into the veterinarian, just to help keep that area clean as best as possible. Cat abscesses are pretty common. Sometimes they, especially outdoor cats, not so common for indoor cats. They usually present with, having a fever. Sometimes they're very occult. You don't see them until finally the abscess ruptures, but usually they just need to be cleaned and flushed, and a lot of times allowed to heal by second intention. The key there is to prevent the cat from licking or damaging that wound further or inoculating it. Usually some antibiotics are required. So again, something that you should probably see your veterinarian. Some of these abscesses are much deeper under the skin than what you can see on the skin. So they should be examined and explored a little bit to make sure that you get good drainage, because that's one of the keys to healing is drainage, antibiotic, wound care, and then let it heal from the inside out primarily. So an e-collar is usually required in addition when they go home. But again, not so common in indoor only cats, obviously, especially single indoor only cats, but these outdoor cats that are interacting with other cats is a fairly common problem. Again, bleeding wounds, emphasize again, make sure they're properly restrained and muzzled if necessary. For a bleeding wound, you can apply direct pressure. You do not want to wipe the wound and try to disturb any clot. The clot is your mechanism to try to help you control bleeding. If the bleeding continues, you can apply some bandaging material to try to apply better direct pressure. If the wound is located on a limb, you can try to elevate the limb and apply direct pressure again, but getting them transported to be further evaluate is probably the best option to do. But again, direct pressure is probably your best ally, and try not to disturb the wound too much until you can get them into a proper facility to be evaluated. You can try to apply pressure to the arteries that supply the area of the wound. For instance, if it's on a right rear leg, you can put pressure on the right femoral artery, which is again the same artery that you can use to assess the heart rate. Pretty difficult to do, I think, for an emergency. You're probably better to spend the time, unless you have help, to get that animal in to be seen. But if you have two people, one that can drive, one can put pressure on the femoral artery to try to stop some of the flow to that limb. In the front limb, you can try to put it in the brachial artery, the armpit area. I find that a little more difficult to do. But again, the key is get them in as quickly as possible and try to apply direct pressure on the actual laceration or wound itself to try to control the bleeding. Oh, this poor dog. So if you have a foreign body, an impaled object, the key there, like a stick or something, especially in the chest area, is do not remove it. You can, if it's a stick and you can do it, you can cut the stick off, or the penetrating object, 3 to 6 inches outside of the pet's body. The reason you don't want to remove it is so you can probably cause more damage until we can assess a little bit further how best to remove that foreign body. It's really important if it's something that's penetrating the chest wall, because if you try to remove that foreign body, you could lacerate the lungs, or you might actually develop a pneumothorax in there, which can be a life-threatening issue. If the animal is having difficulty breathing, which obviously it might have if it has a chest wound or foreign body in the chest cavity, again, get them to the veterinarian as quickly as possible. You can try to gently put some bandage around that area and maybe a little bit of petroleum jelly or something, but get them evaluated as quickly as possible. So bandages can be a two-edged sword if you aren't very familiar with them. The advantages: they control bleeding, they provide protection, they can resist movement, which can exacerbate a problem, and it also can prevent the animal from doing self-trauma from licking or chewing on the area. Some of these might be not a bad idea for you to have in your first aid kit, not just for yourself, but for your animal, of course, which is what we're talking about. The primary layer for a wound is something like a Teflon pad that won't stick to the wound very well, very much, and just provides protection. And then you have a cast padding is typically used. That's the material in the lower left view there of the picture. And then some sort of outer protective layer like vet wrap or an adhesive type, which is the purple material in the picture. Never use anything around the neck, like a string or a rope or anything along those lines, because that can be cut off airflow and can lead to more problems than they help. So here's just kind of an example of if you were applying one of these wounds, they're putting a little pad over the wound there, and then putting some padding to help protect it on the upper right. What we call cling is just something that you can stretch down and put pressure on that, again, to protect it, keep it from being damaged by the animal or pet. And then finally, some what we call vet wrap around an elastic one that's kind of sticky, so it keeps that bandage in place. But again, you want to make sure that you get these animals evaluated, because bandages can sometimes cause some problems if you're not familiar with them, or if you put them on too tight, or if you restrict too much blood flow. So that's things to look for. So if you've got a bandage, even if you go to the veterinarian and you send your pet is sent home with a bandage, you must be very, very careful to watch those toes in this case, or if you see any swelling of the toes, certainly if there's any discharge, or if the dog or cat is acting extremely painful or lame, or if you get the bandage very wet, if they happen to go jump in a lake or swimming or something in the ocean, those are reasons where you must change the bandage. And usually we try to, in these animals, recheck. Your veterinarian will tell you, well, if all is going well, we would still want to recheck that bandage at some point, and they'll advise you when to come back in for a bandage change. But again, if you see any of these signs, that's an indication you need to get in there right away, because that can cause some pretty serious further damage to that area. You can see there can be signs that might indicate that you've got a joint or ligament or bone injury. And again, these are pretty obvious. The animals seem pretty obviously lame or non-weight bearing. Certainly if you see a limb that is severely bruised or seems to be extremely painful when you touch, or obviously a fracture where the bone is coming through an open wound, these are signs where, again, you need to get them in to be evaluated pretty quickly. Again, just most of these are going to be pretty obvious issues. Now, dogs can sometimes have a little lameness if they are overexerting. If they're acting fine in all other aspects, you might want to observe them closely. Not everything has to be an emergency necessarily, but you have to use your judgment. Again, you know your dog and cat better than anyone. So if you feel more comfortable, you can get them evaluated, or you can observe if it's just mild and see if it's something. But again, if you have bruising or swelling or severe pain or an open wound or non-weight bearing, I think that those things should be assessed and evaluated as quickly as possible. Now, talking a little bit about splints, these are going to be very difficult for most people to do. And they're usually best, most effective for issues where you're below the elbow joint, wounds below the elbow joint or fractures, or below the knee joint. Because what you really want to do is you want to extend the splint and above the joint and below the injury. So one joint above, meaning above the elbow in the front leg, and down past the injury on the distal leg, the lower part of the leg. And if they are applied incorrectly, it can cause more damage or trauma than they help. If you put a splint on and it's below the elbow, you're probably not going to be doing very effective. Or if you do it below the knee, you're not going to be very effective. A little bit about gastric dilatation and volvulus. This is a problem we see mostly in larger breed dogs, especially those like deep-chested dogs, German Shepherds, the large breed dogs, but even golden retrievers, Labrador retrievers. And this is a problem where, for reasons we don't always understand, the stomach oftentimes will rotate, and as it rotates, it sort of cuts off the esophagus, and what happens is the stomach distends severely with gas and air, and that's why we kind of call it bloat, in another term you may have heard. It's an emergency that needs to be seen right away. The reason is that if that stomach does twist or turn, it cuts off blood supply to both the stomach, and it can cause loss of blood supply to the spleen, because the spleen usually rotates with the stomach and twists, and not to mention pain and respiratory distress and so forth. So this needs to be seen right away. And again, the way you diagnose that is clinical signs. They're acting uncomfortable, but mainly they have a very tympanic, almost like a drum of a stomach. It's very distended. It needs to be seen right away, because what you have to do is not only alleviate the gas that's in the stomach, but you usually, if it has rotated, the stomach is rotated, it needs surgery to unrotate that, preserve blood supply, because if the blood supply is cut off for too long, that is going to definitely affect their survival rates. So again, signs can be non-productive retching, hypersalivation, distension, that's the key one, abdominal distension, abdominal pain. They need to be seen right away. Here's what we would do usually is take radiographs, and there's a classic kind of picture that we see as veterinarians that would indicate that there has been bloating and twisting of that stomach to confirm the diagnosis along with the clinical signs. And again, the reason this is so important is partly because of prognosis. If you do conservative treatment, if they can't afford surgery, and you can get the gas distended, and then hopefully if there's not too much in the way of loss of blood supply, they can survive this. But again, if it's twisted, it's very difficult to really have a good outcome without surgical intervention and untwisting that stomach and spleen usually. So there's a 67 to 87% survival rate, but it increases all the way up to 98, roughly 90, 98, if there's not any gastric necrosis. And the necrosis means that the blood supply has been cut off and that tissue is so damaged that it cannot repair itself. If there is gastric necrosis, then there's a much less survival rate. And that's why it's so critical to get them in as quickly as possible, because you want to try to prevent that damage to that stomach wall from lack of blood supply being cut off as quickly as possible. Some of these dogs, usually if we do surgery, we will then pexy the stomach to the abdominal wall to prevent reoccurrence. And some people do this prophylactically, actually. They'll just do that when they're spaying their animals, so to try to prevent any occurrence in the future, even if they haven't had the bloat episode. Oh, I hope my dog doesn't have to perform CPR on me, but. All right, toxins, and this is something that is a huge topic. It's very difficult to completely control, but if nothing else, you should know a number for poison control. The ASPCA number here is 888-426-4435. There are also poison controls centers. I think University of Illinois is one that we use quite a bit, and it's very helpful to knowing if they ask certain questions, what your animal got into, how much they got. If you can provide that information, that can go a long way as far as advising you. We use poison control all the time to try to help us with treating some of these animals and what exactly to do. Obviously, it really is very helpful if you know what the toxin is that they ingested. That's not always going to be the case. And that makes it even more difficult to know what to do. So slug bait, a lot of, especially in the springtime when everyone's planting their gardens, and one of the problems with the toxins is that they all often present with very similar clinical signs: vomiting, drooling, inappropriate mentation, increased heart rate, possibly seizures or convulsions, fever. For slug bait, metaldehyde, which affects the brain, the main thing we try to do, and again, another reason to get them in as quickly as possible, is to try to provide supportive care in a way of fluids, hospitalization, muscle relaxants, activated charcoal. It's a little difficult if you see them eat the slug bait or something right away, you may be able to induce vomiting to try to get that out. But once they have clinical signs, probably it's already been absorbed. And usually we also treat with activated charcoal, which tends to bind the toxin and try to eliminate it through the stool. So again, something that hopefully if you know what these animals have and get them in, we can usually support them and get them through this episode safely. Now this one's a little different, ethylene glycol. This is what is often in radiator fluid. They do make a radiator fluid now that does not contain ethylene glycol that's safer for animals. It's a very sweet tasting fluid, so animals like to drink it, especially if you change your own radiator or if you have a radiator leak. This is something that will cause significant or severe or fatal kidney failure. 3 tablespoons can kill a 20-pound dog. Again, vomiting, nausea, weakness. They appear to be drunk. If you know they ate or drank antifreeze that has ethylene glycol, you need to get them into a veterinarian right away. There are some antidotes that we can try to treat them with, including alcohol sometimes. Once the patient is no longer producing urine, the recovery for prognosis is extremely poor. And again, if you have, you might want to change the radiator fluid, or next time you need to buy the kind that does not have the ethylene glycol. And certainly if you have any kind of radiator fluid around, make sure it's in an area where it's protected and they can't get to it, because again, it tastes kind of sweet for them and they like drinking it. Very preventable problem, toxin, and extremely poor prognosis in many cases, because again, we can't sometimes get them seen in time, or we don't recognize what's going on until it's too late. Main thing about flea products is making sure that the ones, if you use for your cat, are designed for your cat, not a dog product, because if you give certain anti-flea medications that are designed for a dog to a cat, it can cause severe toxicity and can even lead to death. So again, most of the time these animals have twitching tremors and need to be supported with fluids, sedatives, muscle relaxants, hospitalizations. Sometimes giving them a bath if it's been applied topically is also helpful. But again, something that if you know that happens, just be aware. Prevention is the key. Be sure you don't apply anything to your cat that is not designated for a cat, that is a dog product, until you at least check with your veterinarian to find out if it's something that is safe to be given to your cat. Always ask. We see a lot of rodenticide problems, and again, because of animals getting into these toxins for mice and rats and so forth that are put out. People think that they've hidden them, but I can't tell you how many times people say, oh, there's been no exposure to any kind of rodenticide, and yet they come in and they're diagnosed with rodenticide toxicity, which usually causes bleeding. So that's how these agents work to kill these rodents, is that they actually bleed internally. And the same thing can happen to your dogs. Now, you may not have any rodenticides placed around your house or in your yard, but certainly if your dog's an outdoor dog, your neighbors might, especially if there's barns around or things along those lines. So the key thing we usually see is that there's bleeding from the nose, there's anemia. They may bleed anywhere. They can bleed inside their chest cavity. So sometimes it isn't super obvious that they're bleeding until you evaluate them. It may not show up for several days. Fortunately, if we can get them in time, they may need transfusions, which can get to be somewhat expensive, but there is an antidote, vitamin K, if we know that there's a rodenticide. If you know what they got into, it would be important to bring that in. There are many different formulas and products. Some require longer treatment post-ingestion than others. Usually we give vitamin K for at least 3 to 4 weeks. We might then check a coagulation panel to make sure that they seem to be back to normal before we stop the vitamin K. These dogs can recover. This is a good prognosis if we can make the diagnosis quickly and initiate therapy quickly. But again, it's something that you want to prevent. So if you have any kind of rodenticides around, or if your neighbors do, just really make sure that they are absolutely not able to be reached by your dog. Now, cats are generally not as prone to eating foreign things as dogs are, so they're not, but still the same holds true for cats. Serotonin syndrome is a little difficult to diagnose. It's a problem where serotonin is increased, and usually it's from animals getting into either their human medication like antidepressants, buspirone, even cocaine, opioids. Some animals can be given a combination of medications that can lead to this. So if there's, one of the questions we always ask is there, if we think there's something like this going on, is there any evidence that you know of where they could have gotten into your medication, or is the animal on any medication? Have you added anything recently to the medication that they're currently on? Again, the problem is toxicity is vomiting, difficult breathing, drooling, seizures, tremors. It can progress quite quickly within a few hours. So again, supportive care. Again, a lot of these toxicities present with very similar clinical signs. Mentation is altered, tremors, seizures, and the key is knowing what they got into if possible. Unfortunately, a lot of times we don't know, and we're left with trying to do supportive care and trying to figure out exactly what they've gotten into. Now, one interesting thing, and I think most people know about this now, but it really wasn't known when I started veterinary medicine, that grapes and raisins in some dogs will cause acute kidney failure. And we don't know what the toxin is in grapes. And I think growing up, my dogs got grapes, and I don't think none of them ever had any problem. We're kind of at a loss. It'd be interesting to see if they can figure this out. And not every animal who gets grapes will have kidney issues or problems. But again, the key thing to know is to know about it, especially for if you have kids or anything that might not be aware. No raisins, no grapes. If they ingest the raisins or grapes, which happens sometimes, they get into them without you knowing it. It's best to have them go into the hospital, do some preventative care, which is mostly IV fluids. And if the kidneys are affected, if there's severe kidney disease, it may require some sort of dialysis, which is not very readily available, and also quite expensive. There's not that many facilities that are able to do any kind of dialysis. So again, the key here is prevention, no grapes or raisins, keep them up on the counter away from your animals if you have them, or inform your kids and everything too, that they are aware that these are very toxic to their dog. Again, cats, we don't know about cats, but I have not known any issue with cats. Xylitol is a fairly common sugar substitute. Mostly we see it in chewing gum, but it can be in a lot of other products. And it causes severe hypoglycemia, which is low blood sugar. And that can lead to neurologic signs and seizures and so forth. So again, the treatment is usually we will provide them with IV fluid supplemented with sugar called dextrose. And we also need to also protect the liver and the GI tract, which can be affected. Sometimes activated charcoal, again, to try to act as an absorbent. But again, 2 or 3 sticks of xylitol chewing gum can really cause serious hypoglycemia problems. So it's one of the first things we ask is if an animal comes in with hypoglycemia and clinical signs, is if they've had any xylitol possible exposure. There's many other things that can cause hypoglycemia. This is just one that at least we can have some treatment and some success there in many cases. Real key is, some of these anti-pain medications, you want to be careful with them. Follow your veterinarian's advice. For instance, aspirin will block platelets, all your platelets from functioning. That's why if you're going in for a particular surgical procedure, your doctor will tell you no aspirin for several days before the procedure, because bleeding can be a real complication. There are some non-steroidal anti-inflammatories that won't block the platelets that are a little safer, but even things like ibuprofen, acetaminophen, and so forth can cause ulcers, kidney disease. Again, this is more of a problem if they get into a large amount of it. But again, you want to just follow, if you're sent home with pain medications like these, follow your veterinarian's instructions. Don't just think, well, if a little bit helps, I'm going to give a little bit more. Again, you can see vomiting, depression. Again, if it's aspirin, you might see bleeding because again, their platelets are not functioning, which is your primary coagulation, first coagulation protection. And again, the treatment is supportive and possibly red blood cells if they are bleeding. Now in cats, this is even more critical. 1 Tylenol or 2 Tylenols can certainly potentially kill a cat. They're very, very drug sensitive to these agents, and never give any kind of pain medication to your cat unless you have been advised or prescribed from your veterinarian. If you have questions, just call, because this can be obviously another very preventable issue if you don't know about the danger in just giving your animals medications like this. We see a fair amount of toxicity. Again, dogs love chocolate. Usually this is a problem where maybe kids have a chocolate bar. My own kids leave a chocolate bar lying around. The dogs have eaten it. We've had to take our own dogs in. Again, prevention, knowing that the caffeine and theobromine, which are in chocolate, can cause vomiting, clinical signs, diarrhea, tremors, seizures. It depends a little bit on whether it's what kind of chocolate it is. If it's a more darker chocolate, that tends to be worse. It also depends on the amount. So try the best you can. If you know they got into it, bring the packet in with it, and try to determine how much they might have gotten. that sometimes determines prognosis and treatment, how aggressive we need to be treatment-wise. So again, same thing, seizures, tremors, vomiting, diarrhea, abnormal heart rate. Treatment is fluids, again, charcoal, possibly vomiting, depending on how long ago they ate the chocolate. If it's right away, then inducing vomiting might be something to try. But if they're already showing clinical signs, it may be that vomiting is not going to really be helpful because the agent has already been absorbed. Chocolate's a sugar, so it gets absorbed pretty quickly from the GI, from the stomach and GI tract. Again, prevention, keeping these agents, these chocolate situations, especially around Halloween time, which is coming up. That's when we see a lot with kids going trick-or-treating and getting a lot of chocolate. These dogs will eat this without blinking an eyeball if they can get access to it. Not something that's very common, but just know about it. Blue-green algae, if you hear any warnings on the news about areas that have blue-green algae outbreaks, or certainly if you see any kind of algae growing, do not allow your animals to drink this water. There is no antidote. This is really very, very dangerous. Fortunately, it's not very common, but who knows, again, with global warming, whether this might become more of an issue. Again, just don't let them swim or drink any water that looks like it might have algae in there. Again, the best treatment is prevention. There really is no antidote if they get into this, and it's a very serious problem. I don't even want to go into too much about the number of different plants that can cause toxicity in both dogs and cats. Indoor cats generally don't have as much problem, but certainly if your dog's outdoor, any of these can cause problems in a lot of different signs. Again, very similar to a lot of other toxicities. But one thing to keep in mind were lilies and cats. Any part of the lily plant is very, very dangerous. Cats will sometimes chew on plants. If you have lilies in your house and you have a cat, I would probably suggest you not take the risk. And you can go to www.aspca.org. And again, as it says here on the screen, click on pet care and poison. And you can get a list of the toxic plants that are out there, and then you can assess your own inventory and determine if you think any of those are a severe danger. It's hard to stop animals from eating plants. I guess you just have to try to determine if they've gotten into anything. And again, prevention, at least for indoor animals, especially cats, is going to pretty much eliminate this. For dogs, you can decide based on what you have in your yard or garden whether you want to continue having those plants available in case your dogs eat them. Marijuana, again, we see a lot of animals that come in with clinical signs of depression, and they can have tremors, weakness, and you question the owners. One of the things we have to try to ask is if there is marijuana at the home, which often is the dogs just get into their owner's medication. And usually, again, supportive care is helpful. These animals can recover with some time. It's usually accidental. They eat edibles, and especially with marijuana being legal and so much more available in the home front, just again, make sure you prevent your dog from getting access to these. We see drug-induced from eating human drugs quite commonly. It's sometimes the owners are very reluctant to admit it, and it makes our job a little more difficult, but certainly it's prevention is the key. So again, another toxicity, mole and gopher and rat bait. Again, we talked a little bit about rodenticides before, but in this case, zinc phosphide will cause a gas to build up in the stomach, and it can be quite toxic. It can cause severe illness, acute liver failure, and even death in dogs. So again, if you have mole and gopher bait, Do not, if you place it out to try it in a hole or go for a hole, just keep your dogs away from there if you can. And certainly if you have the product, don't have it be placed someplace where the dogs could chew the bottle and get access to it. Again, prevention is the key, as most toxicities. A lot of us like to try to compost. We're trying to save throwing out compostable garbage and using it that we can then apply to our flower beds or our gardens. Mycotoxins are fairly common in compost, especially nuts or grains or pasta. The key there is just if you have compost, try to best you can to prevent your animals from having access to it. It again causes mostly neurologic signs, ataxia, but also hypersalivation, tremors, seizures, tachycardia. Again, same signs we see in so many toxicities, which that's why a history is so important for us, not just for prognosis, but how to treat them. And again, these are mostly more fungal related issues that accumulate in compost. So just being very careful with the compost. We do see snake bites, not so much on this side of the Cascades, but on the other side, west slope of the Cascades. Again, animals may not, obviously don't realize that a snake is venomous. There's only one rattlesnake here in Oregon. If you have an animal that you're backpacking or hiking or on the other side and they get bitten, mostly it's going to be animals, of course, sticking their nose in there, the head and limbs. The clinical signs are obviously swelling of the face or a limb, history of being in an area where rattlesnakes are present, or obviously hearing or seeing the rattlesnake. You see bleeding from puncture wound areas. The key thing there is to get them transported as quickly as possible. Keep the limb or bite area, if possible, below the level of the heart. Do not apply ice or tourniquets. Do not try to capture the snake. Do not slash and try to suck out the venom at the site of the bite. And do not administer any kind of medications, especially NSAIDs or aspirin, which can exacerbate the problem. The key treatment is usually supportive care and anti-venom, which again means that these animals need to be seen at an urgent care or emergency hospital that has anti-venom along with supportive care. Fortunately, prognosis is going to depend a little bit on the size of the animal, also how much venom was actually injected. Not all bites inject venom, but if they get bitten, get them into the hospital as soon as possible for monitoring, supportive care, and potential treatment with anti-venom. Bees and wasps venom, not super common, usually causes local treatment or local signs that may just need to be treated with some antihistamines and some pain medication. But again, if you, in certain times of the year, like right now, some of these yellow jacket nests become very, very active and they can swarm and you can get very severe reactions. We all know people who just getting stung by one bee can cause a very, very severe reaction. So again, not always known if they've got a bee or wasp being stung there unless you've seen it. But again, they can get, if they're very, very severe reactions, just like in people, and it may require supportive care. And just, again, if you're seeing signs, get them in to be seen. Fortunately, most dogs, if they just get stung once, they're trying to bite a bee or so, they may have a little local reaction, but they're pretty safe. So monitor them very carefully. If they start to show any signs, get them in for treatment. Spider bites are not very common. Hobo spider, brown recluse are the two main ones that we see in this area. It usually causes necrosis in the area of the bite wound. It's very, very, very difficult to prove that it's a spider bite. It's usually just something that we, by a process of elimination, or if we know we're in an area where these spiders might be, but everything is labeled as a possible spider bite because we just never know We just don't never have a history of actually seeing it or so. Usually it's something else besides spider bites that are causing the problem, but again, they do exist. All right, so this is something Dr. Coach has put together. He was one of he was our medical director and then an ER doctor at our facility. Now he's the medical director at Oregon Humane Society. But emergencies we see real commonly in the ER. And shock. This is something to try to recognize. It's not always easy for you to see, but it's due to a lack of adequate blood flow and perfusion to the body parts. So it can be caused, as you can see on the list, any number of different things can cause animals to go into shock. This is, again, a severe emergency and needs to be treated aggressively and immediately as soon as possible, because shock can certainly lead to cardiopulmonary arrest, death, and also there's usually an underlying reason for the shock that needs to be addressed as well. So the problem is that you can see different signs. They can be tachycardic, meaning they have a high heart rate, or they can have a bradycardia, which means a low heart rate. They can have bounding pulses, or they may not have they can have weak pulses. Mentation is usually inappropriate. They're weak. They don't want to stand. Their gums may be pale. Again, if you check underneath, it's a little harder in cats, but gray or white. And again, if there's something that has happened recently, like trauma, shock is something that you want to be monitoring for, signs of shock. But again, your best bet is to get these animals in as quickly as possible to treat for shock. Even if it isn't present, we always try to treat them to prevent shock from developing if it hasn't already. Get them into the hospital. You can, again, monitor if you're on your way in, their breathing ability, their circulation, try to control any bleeding that you can. It's very unlikely you're going to have oxygen available at home. You can assess their temperature. Again, not much you can do to help them with fever and so forth until you treat the shock. Keep calm as best you can. Try to prevent further blood loss and injury, and get them seen immediately. Trauma is usually fairly obvious, but not always. They can be, certainly hit by cars is one of the main things that we see. Interesting, in cats, they have a syndrome called high-rise injury, where this is more, I saw this in New York all the time, where cats would actually jump out windows, and studies have shown that actually the higher they fell, the longer distance that they fell from the window, the less trauma that they ended up having. Not quite sure why, but you can also have trauma that you can't see. For instance, animals that are hit by car, that even if they don't have external trauma, can have very, very, very severe internal trauma, ruptured bladders. They can get pneumothorax from having a lung punctured. Obviously, certain fractures or wounds can be seen. Head trauma, it can be obvious if there's actual visual trauma, but also if issues with mentation, seizures, and so forth. So again, here, this is just a picture of a normal thorax, what we call a lateral view. The structure in the middle of there is the heart. The black tube is your trachea. But what we see sometimes in dogs that have had trauma is they'll develop pneumothorax. And what we see here is the heart, the sternum is the lower part, and the heart is raised up off the sternum. That means there's air between the heart and the chest wall. And this is something that is a very serious problem, because if you can't remove that air or treat that, it can constrict the heart from being able to expand and lead to shock and death as well. And if there's a leak or something in the lungs, that's going to lead to a progressive pneumothorax and may need to be addressed as soon as possible. A little bit about submersion injury, and it's a little different versus salt water, which you guys in Cannon Beach in that area are going to be probably more dealing with than versus freshwater. But keep in mind, it doesn't take a lot of water for an animal, just like children and infants, to drown. You can get problems with if they're drinking, excessively as well. But most of these are going to be from, swimming or in the ocean or in lakes or so forth. Now, if you have a freshwater submersion injury, you want to remove the water source, get them away from wherever it is they're drinking too much water, assess their airway, their breathing, their cardiopulmonary situation, their heart rate. If they're not breathing, clear the mouth. If you can, be careful again, opening the mouth and sticking your fingers in there. But if there's something there, any debris, do not try to hold the animal upside down and remove the water. Fresh water will be absorbed, but if you need to do CPR, if you get them resuscitated, if they get their heart rate and their breathing back, wrap in warm water, dry blankets, and get them obviously to a veterinary facility. Now, the big difference is saltwater. In saltwater submersion injury, this is where because saltwater can be so toxic from the salt, you do, if you can, want to get that water out of their stomachs if possible. And this may be a case where raising the rear half of the submersion victim, the pet's body, higher than the front half, and hopefully you can get some of that water out of there, or they can eliminate it. You can perform a couple of chest compressions to aid in removing excess water from the upper and lower airways, because in these animals, not only is the water intake problem, but the salt, it can be a very, very severe problem. Again, try to clear the mouth and nose, upper airway areas, provide CPR if you can, if needed, and then again, get them in to the veterinary clinic for further supportive care. Hypothermia, not something we see quite as commonly as hyperthermia, but obviously in the wintertime, depending on the animal, the coat, if they're outside dogs and they're left outside, they can certainly develop hypothermia. Again, it's usually a pretty clear diagnosis based just on the temperature and the history and signs. Most of the time, if it isn't too severe, just getting them in supportive care and warming them will resolve. Again, sometimes they can fall through the ice like in this picture below, but that's not super common. The key thing is to wrap them in warm blankets or towels. If the animal's wet or cold, a hair dryer, but be very, very careful with a hair dryer that you do not burn them. They can burn very easily. And that is why we do not recommend using heating pads, electric blankets, or hot water bottles that are placed against the skin. Or even if you don't place them against the skin, you've got to protect them. We see a lot of thermal burn sometimes from heating pads used inappropriately, and electric blankets. But warming them in towels that are gently warmed, perhaps, or warm water bottles wrapped in towels, just be very careful. But the key thing, get them in to be assessed, and they can do further supportive care. And usually, if we can catch them in time, they can make a complete recovery in most cases. Heat strokes, a little different situation in that we see this mostly again in animals that are, you hear about the stories that they're left in the car without windows open or water, or just, I never recommend taking your animal in your car with you on any day where it's extremely hot. Even a few minutes jumping into the supermarket or so can be enough to cause them to become overheated. We also see this a lot on people who overexercise their dogs, take them hiking or hunting during the middle of the day when it's really super hot. That doesn't affect cats so much, but it's mainly these animals that are outside. And also, we'll talk a little bit about this, and mainly some of the breeds that are what we call brachycephalic, the Boston Terriers, the ones that have some airway obstruction already anatomically present. They can heat up very, very, very quickly. And again, prevention is key here. They can also have problems if they're moderately overweight. So you want another reason to keep their weight down as much as possible. The reason they can get overheated so quickly is that, unlike us who have sweat glands on large parts of our bodies and so forth, Dogs can only really dissipate heat through panting, and the only sweat glands they have are in their feet. So they don't have the ability to eliminate heat quite as effectively as we do. So exposure to heat can really come on quickly and causing clinical signs in these dogs. And that's why if you're hiking with them, make sure you always have water, or try to hike around an area where they can get water. Don't make them, some dogs don't know how to pace themselves, certain breeds. Just take rests, watch your dog carefully. And certainly in the car, or that is something that you just do not want to do. If you've got some of these breeds and you know it's gonna be a hot day, but you wanna take them out, we suggest you take them for walks, short walks in the morning when it's cooler, or in the evening when it's cooler. If you have signs and you take a temperature, and certainly if the temperature is greater than 105, heat stroke is quite common. It's a very serious problem, not a great prognosis, depending on the situation and the advancement of the heat stroke and how long they've been in heat stroke. They can have dementia, disorientation, obviously fever, very agitation, needs to be addressed very, very quickly. This is a really severe emergency. Cooling measures, we don't recommend using ice baths. You can apply wet, cool towels. You can try to give them water a little bit if they are conscious enough. Don't force overheated dogs to drink water though. If they want to drink, let them have small sips. They can lick on ice cubes, things like that. But the key is to try to get them away from the source of the heat, and to try to cool them down gradually, and get them in to be evaluated as quickly as possible. Because again, the time is critical here, and prognosis is going to be based on how quickly we can initiate treatment and prevent the heat stroke from causing severe damage to all internal organs. As I mentioned, brachycephalic breeds, these are dogs that have trouble breathing to begin with. So they're even more, to kind of reiterate on the heat stroke, even more likely to have problems with it. It's not just large breed dogs, but pugs, Boston Terriers, Bulldogs, Pekingese, Boxers, all these breeds, they have changes that they're kind of been bred into them. And there are 4 areas that cause them to have that kind of snorty breathing sound that you hear so commonly. They have what we call stenotic nares, where their openings in their nasal cavity, their external openings there, are kind of closed down. They're not open as wide as they should be in normal dogs. Your soft palate is elongated, which interferes with getting air down into your trachea. And that's because they've got these squished in noses so much. They can have tracheal stenosis, which is a narrowing of the trachea. Again, it's an inherent problem in some of these dogs. And then there is what they call everted laryngeal saccules. These are tissue that lie in your larynx. And when you breathe excessively, if you're having trouble breathing, these little saccules, which really don't provide much in the way of any purpose, they'll pop out of their little recesses in the larynx and cause further obstruction of the airway. So there's actual tissue there that is blocking your ability to take adequate air down into your trachea. Again, these dogs can have problems even if they're not exerting themselves, exercising wise, but they're very, very, very prone, especially if they are overexerted or left in a hot car or get hyperthermic. So much more prone to heat stroke, as we talked about. They're also a little risky anesthesia-wise, because again, anytime you have a dog with respiratory issues, you've got to be very careful not to overdo it in your haste to try to treat them. You've got to try to get these animals a little bit sedated and evaluated. Do not exercise them in hot weather, obviously. And again, a lot of these animals can be treated with surgical means. And we'll talk about that in a little bit. So the surgery generally is you can go in and you can take a little wedge out of the nares to open those areas up. open the airway so they can breathe through their nose, they can get more air in. You can shorten the soft palate, and that will help eliminate some obstruction. And you can also snip out those everted sacral tissues. They really don't have much function, and that again opens it. So a lot of these dogs, even if they're not having heat stroke or so, benefit from having that surgery done, especially if they're having clinical signs at rest. And we do a tremendous number of these surgeries. Usually it really significantly improves their clinical signs. Not all dogs need to have that done, of course, not if they're brachycephalic, but if they're really having clinical signs, your veterinarian may suggest that that's something that might really help them. Asthma in cats is very, very common. As a matter of fact, they use cats a lot of times as a model to try to understand human asthma. It can come on very, very quickly. It can be intermittent. It can be very severe. They can have hypersensitivity reaction to certain ingredients like Febreze and so forth. Their signs are usually, again, that they're having signs of trouble breathing, open mouth breathing. It's usually a hypersensitivity reaction. And they can have actual asthma attacks very similar to humans, and people die of asthma attacks in humans. So we take this as a very serious problem. The same thing can happen in cats. Prevention is to try to avoid certain ingredients, air fresheners, cleaners. If your cat has a history of asthma, I often ask people if they have indoor fireplaces, or if any of them is an indoor cigarette smoker or cigar smoker. Dust can be a trigger. The key thing here in an emergency is to try to keep yourself and your cat calm. Do not try to give anything by mouth. If they're open mouth breathing, especially, and having issues, try to get them into the veterinarian as quickly as possible. This is another case where we as veterinarians have to have a fine line. We want to try to treat them, but sometimes if you try to do too much too quickly to these animals, you can actually put them into respiratory arrest. So usually we try to just sedate them, keep them calm, give them oxygen. Once, hopefully, if maybe some anti-Benadryl and so forth. But usually if we can take our time, we can get them over the asthma attack, and then we can try to do some things like bronchodilators to be treated at home to prevent further asthma attacks, or if you think they're getting another asthma attack. Very similar to people.
Hey, Bob.
Yeah.
Sorry to interrupt. We're at about an hour and a half, and I just thought I'd see if we want to take a little break for questions, if people need a break
Yeah.
to stand and stretch.
Yeah, I don't think we're over the bulk of it, so there's not too much left, I think. But yeah, if we want to take a little break, and I'm certainly available to answer questions, and I'll be available after the lecture to answer more questions too.
Yeah, so if anybody has a pressing question and wants to unmute their microphone and ask, it's great. There were several questions in the chat box that I tried to answer, but maybe we can review those if nobody has any questions they want to ask right now. Kay Wyatt asked, can grapes also affect cats, cause the kidney failure in cats?
I have not seen that or heard of that. Fortunately, most cats are too smart to eat grapes. They're kind of picky. But I guess there's always that possibility. But I have not heard of anything in the literature where this affects cats or even other animals, to that matter, other than dogs. I don't know that for a fact. But have you heard anything in cats? I've never heard anything.
I have not heard of it in cats.
Yeah. But I wouldn't offer grapes to a cat. I mean, I guess there's no reason to. They don't need them, and so why? Yeah. Even remotely take a chance.
And that includes red wine and things like that. Don't include your cats in a toast.
Yeah, or raisins. Again, remember raisins too. Or
so Lila asked, do they use SAM splints for pets? And I don't know if you even know. It's not something we use in veterinary medicine. So a SAM splint is an aluminum splint with padding on it that rolls up, and then you can unroll it and shape it to different shapes.
If you can apply that splint appropriately, and that means, again, above the joint where the wound is and below the wound, and you're comfortable, I mean, if you had a little training in it, then you can, but I would always still take them into a veterinarian to have that splint evaluated and see if it's appropriate or not. Again, splints can be actually more detrimental if they're not applied correctly than no splint at all. So I think it depends on certainly medical people, nurses and so forth, maybe very more experienced and comfortable with splints than someone who's not doing that as part of their livelihood or whatever training. So I would avoid them probably if you feel you can get them in to be seen pretty quickly and at least assessed. But in some instances, they may be helpful.
Okay, three more questions in the chat. Are there EpiPens for pets?
Yeah, there are for dogs can have that, and that's something you can check with. The key thing there is there's a lot of people carry EpiPens because they have such reactions to certain things like bee stings and so forth. But you want to be careful that what you give yourself as a dose may not be appropriate, certainly for your cat, especially if they're having an asthma attack. So I usually we rely more on inhalers, and the way we treat cats a lot of times with asthma is there is a mask that you can get called an AeroCat, and your veterinarian can talk to you about that, where you can apply it and then you can give a bronchodilator right through the mask, and they breathe in that bronchodilator. Now the problem is not all cats want to have a mask on there, and also when you do a bronchodilator, you want to really inhale. When we use them, they say give a little blast and then deep breathe in to get that medication down into your lungs. Well, that may not always be the case. You can't tell a cat to do that. So having some potential epinephrine may be an option, but it would be only something I would do under the guidance of your veterinarian to make sure you know when it's appropriate to give it in an emergency, and also that you're giving the right amount, because that can be very dangerous drug if it's inappropriately administered.
Good. Do you recommend rattlesnake vaccine for dogs that live in rattlesnake country?
Be truthful, I don't know how effective that vaccine is. I've not heard of a rattlesnake vaccine. So that I don't know. I would have to probably ask some of the veterinarians who practice, like in the Dalles or Hood River even, or who may have more cases and experience with rattlesnake bites, but I've not heard of a rattlesnake vaccine. I'm not sure.
Yeah, I've heard of it because I don't think I've ever practiced in an area where it was a high risk. I
Right.
don't know much about it.
Yeah, I don't know how often do you have to give that, and how long, how long it lasts effectively, whether even if you have a vaccine and you give it and they get bitten, I think you still need to get them in to be at least monitored and evaluated. So I wouldn't want to give out bad advice. I guess I would talk to maybe look online or something to see what the recommendations are, because I have no experience with that vaccine. And for what I do as an internal medicine, I'm not so much on the ER side. I don't see rattlesnake bites myself. I can try to reach out to some of the emergency and critical care veterinarians. They may certainly have more knowledge on that question.
Okay, last question. Logan asked, related to hypothermia, is there a similar risk of shock as in people? When he learned about it, he was instructed to reheat very gradually,
Yes.
not too rapidly or probably overheat.
Right. I think that's probably correct. Try to dry them, warm them, gradual. That's why, again, you want to be careful with even a hair dryer or so. Gradual improvement in increasing the temperature back towards normal, and supportive care is your best treatment. Obviously, try to get them to a facility where they aren't being exposed to anything that could exacerbate the hypothermia inside, and so forth. Warm blanket, would be a gradual improvement is always probably better than a super aggressive one.
Okay, one more question. How do you deliver rescue breaths to brachycephalic dogs prior to transfer to the ER?
No, it's very difficult to do. The best you can try to do is normally we try to pinch off the nose a little bit and put your mouth over their muzzle and really forceful breaths. It's going to be a little harder with these brachycephalics, but you just got to try to do the best you can. Especially, you want to be careful that you don't induce further stress. But it's not. It's something to try, but it's not always easy to do or effective depending on the state of the animal and their anatomy as well. But just try to get over their mouth as best you can and see if you can cause the chest wall to expand to at least know that you've gotten some air in there.
Okay, I will let you get back to your presentation. Thanks.
I don't think we've got too many more. I think there's 100 slides. I'm not sure what slide number we're on, but we're getting close to the end, I think. Okay. All right. Choking. Usually, if they're eating, you give them bones or other issues that can cause choking. We see a lot with some of these greenies where they get them stuck in their esophagus. Don't confuse choking with necessarily a breathing problem. It's more a problem with something usually in the esophagus or in the oral cavity. Sticks, treats, toys. Again, they're pawing at their face, maybe acting some anxiety. If you feed them anything, they may regurgitate that food, which means the food comes right back out, or the water, if they drink, comes back out. Try to look in the oral cavity. You can try a little brief push behind the ribs to see if there's something that you can pop out, especially if you know they ate something. But again, stay calm and get them evaluated. You're not going to see very many dogs that come in with a big bone like that stuck in there, but occasionally we see that. A little bit about salmon poisoning, and something that is more of a problem in the Northwest than it is any other part of the country. It's a rickettsial disease, which is an infectious agent. They get it from ingesting uncooked salmon or even some trout. Now, it can just be the guts of the salmon. It doesn't have to be the meat. So exposure of eating raw salmon, if they have fever, lethargy, bloody diarrhea, this is a very common toxicity we see. Many times the owners swear they've had no exposure to salmon poisoning, and yet we diagnose this. You can find the infectious agents, eggs in the stool sample. You can sometimes find it if their lymph nodes are enlarged. You can see the agent in the lymph node aspirates submitted for cytology. But again, history helps us a great deal. It usually is a fairly treatable disease with antibiotics and supportive care, as long as you know that's what you're treating appropriately. Do not allow them to eat raw salmon. If you have salmon and you fillet it at home, make sure the guts and the rest of the fish are properly disposed of and not just placed in the garbage can where animals can smell it or get into it. We also see it where they get it from someone else's garbage, a neighbor or somebody that we don't even know that they had salmon recently. Flock cats, very common in male cats. It's the inability to urinate. What you'll see is that if they're indoors, they're vocalizing, they're going to their litter pan, they're trying to urinate, they're straining, but you're not seeing any urine production, or if you see urine, it's a small amount and it's fairly bloody. This is another emergency because if they cannot urinate, it can cause severe, not only just pain there, but it can cause severe electrolyte abnormalities, especially hyperkalemia, which is increased potassium, that can be very, very severe metabolic disorder and can cause death or so. Ruptured bladder is not too common, but a possibility as well. Vaccine reactions, just like people, we see it in both dogs and cats. Usually more typical on the second vaccine, maybe if they've had exposure to a previous vaccine. Most of the times it's not much of a problem. antihistamines, maybe a little steroids, and supportive care, knowing if they have a vaccine reaction, whether or not to avoid that vaccine. If you can localize what it was in the vaccine in the future, can be avoided to prevent a further reaction. It's always difficult to know if an animal's in pain. Some animals are very stoic. Some animals cry out if you just touch them. I have a little terrier that if I try to put a leash on him, he screams, and he's perfectly fine. But again, vocalizing, respiratory rate is increased. They're uncomfortable. They're clearly agitated. Cats generally hide this much more than dogs. Be careful, again, do not just give pain medications that you have available for yourself to your pets without further guidance or knowledge. Okay, so that is the end of the presentation. We answered some questions, but I'm happy to stick around if people have other questions or anything.
Wonderful. Thank you very much. That was great. Feel free to turn on your microphones and join the conversation, even if you don't have any questions. Thank you so much, Bob.
Just wanted to say thank you. Loved your detailed slides.
Yeah, a lot of information there. I'm sorry I had to kind of go through quickly. You know, there's just so many things that pop up. I think the key for all of you is to try to have some sort of first aid kit and have some numbers available. Know where your veterinarians are, know what emergency clinics are open after hours. Just a lot of prevention and some basic knowledge will go a long way, because these animals just don't know sometimes what's best for them, obviously. And they can't talk to us, but as I tell my human clients who are in the medical profession, they don't lie to us either, though.
Thank you to Bob and Bob. That was very helpful.
Thanks.
Thanks, everybody. And some of you I don't recognize. If you live close to Cannon Beach and have interest in getting involved with the disaster animal response team, you're certainly invited to get in touch with me, or you can find my contact information if you didn't get it with the emails that I sent out with the link for this meeting. You can go to the website for the City of Cannon Beach, to the emergency management page, and then find the disaster animal response team link, and my contact information should be there. And even if you don't live in Cannon Beach, you're certainly invited to participate. And I figure we all learn from each other. And if you're elsewhere when some sort of a crisis occurs, then you can still share that your experience and your knowledge wherever you are. So we're happy to kind of let the information go in all directions.
Can I ask a question?
Sure.
Thank you. I very much appreciate this information. Thank you. But I want to ask a little more clarification about choking, specifically related to, you might hear coughing, and I, being a nurse, more likely a human will not have any sound. And so I'm just curious about the coughing that you referred to in the slide.
I think coughing versus choking can sometimes be difficult to differentiate. I think in people, it's probably, hopefully, if they can talk to you, they can tell you they're choking. I always ask my kids when they're really having a choking thing, can you talk to me? Because if they can talk to me, I think their airway's probably okay. And it's more like they just swallowed wrong or something like that. But obviously you can't ask dogs that. The choking is going to be, I think, a little more hypersalivation, agitation, like there's something wrong in their oral cavity. Again, there may be a history that they just ate too fast, or some of these dogs eat so fast that they'll choke. Or if they had just been given a bone recently or a foreign body. But there seem to be more agitated and the choking is a little more clear. But you've got to also rule out that they're not just reverse sneezing. A lot of dogs, smaller dogs especially, will have reverse sneezing, which is kind of like more like a type of noise that especially the brachycephalics and the terriers and the small breeds have. And it's usually not something that's a critical problem, just trying to calm them down. It's more of like a reflex. I don't really understand why they do that. But certainly also if your dog has signs and they try to take a drink of water and the water seems to come back up right away, what we call regurgitation, or food for that matter, comes back up without being digested. It looks just like what they ate and was fairly rapid after they ate. That would be an indication that they may have signs of a foreign body or possibly a stricture, something along those lines in the esophagus. And usually we can tell that pretty quickly with a radiograph, which also can be used to help if you're not sure if they're choking or not. Is there airway disease versus esophageal changes are there?
So
When they're choking, they'll also do aerophagia. They'll get they'll breathe in more air than normal, and they might get a little bloated, but that's not always the case.
So Len posted in the chat a reference. He found a pet first aid manual put out by the Red Cross and provided the reference in the chat. It's called Pet First Aid, Cats and Dogs by Dr. Mamoto, Mammato, if people want to look for that, a veterinarian and public health veterinarian. Logan posted that the Red Cross also has a nice phone application with information on this. And Logan, I see, is raising his hand. Maybe you'd like to unmute, and if it's a question or that's just what you wanted to say.
Oh yeah, thank you. I was hoping you might be able to expand more on hyperthermia. Oh, sorry, no, heat exhaustion, especially for double-coated breeds.
Yeah, I mean, depending on the breed, my German Shepherd isn't nearly as much danger as my heavy-coated Golden Retriever. So if they are thick-coated double breed or double-coated dogs like that, you've got to be even extra careful that they can get overheated even quicker. So again, I think if you're going to, on hot days, if you're out with your dog doing something activity-wise, avoid, extreme exercise, throwing the ball for them or whatever, the stick or whatever you're doing during the hot part of the day. If you're hiking with them, make sure you take, I think a good thing to take along with you is like a collapsible water bowl where you can, if you have enough water, then you can fill the bowl and just give them intermittent drinks. Try to avoid hiking anytime when the temperature is going to be super high. We saw a lot of heat stroke cases this last summer, especially during those days when it was 115 or so, those 3-day stretches. Even lying out on your deck in the sunshine just can cause hyperthermia. They don't have to necessarily be exercising if it's hot enough outside. So again, it's mostly just avoiding the problem by choosing how much and when to exercise your pet, and obviously avoiding, the main thing we see is more where animals are left in cars, quite truthfully, that they get. And now some people will actually, I don't necessarily recommend it, but they will actually shave their dog for the summer to try to eliminate a lot of the hair coat and keep them a little cooler. Although again, they can't sweat through their skin like people can.
Okay, thank you. Follow up is what, living on the coast, the ambient temperature that might be safe, maybe a little different than what's in a dramatically less humid area like the metro. Is there a good, for that, for hiking and going on a run with your dog, what is the good threshold for ambient temperature to be aware of?
I would say if it's over, and I'm just pulling this off the top of my head, but I would say anytime that it looks like during the middle of the day, it's going to get above 85, you want to be very, very careful. Certainly anything above 90, I would not recommend. if you're going to do something with your dog, like a walk or so, or even a run, like you said, where you live, you're not quite as much danger as we can have here, or even on the other side of the Cascades. I think you guys are a lot safer about getting hyperthermia than some other areas of the state. But again, the car can be a different situation. So, but I would say if it's above 85, and I might limit my run a little less than maybe what if I normally ran 3 miles, I might just run 1 and maybe run back, so you don't get too far out away from home, where, nothing's worse than trying to backpack your dog out of the woods. And that's happened a lot of times where people had to just leave their backpacks and carry their dogs out. So you want to just not maybe go as far away from home as you might normally do on a really cool day. Fortunately, most dogs, are going to be able to adapt. If the temperature is below 85 or so, they're going to be okay. But I still would watch them, because again, if they have other issues, other breathing problems, like those brachycephalic dogs, or if they've got a disease called laryngeal paralysis, where their larynx can't open properly when they are breathing, it remains kind of closed, they are way more prone to hyperthermia than they would be, normal. Any breed dog can be. And that's something we see, laryngeal paralysis. We didn't talk about it, but that's a very common in larger breed dogs, where they lose the ability to open their larynx. So when they're panting, their larynx is maximally opened. But if it's paralyzed, it's a nerve that goes to the larynx that is no longer functioning. It doesn't allow that larynx to open as widely as it should. And therefore, you're allowing less air to flow through the tube, because the tube is narrower. So that would be, if your dog has been diagnosed with any kind of respiratory issue like that, then you also want to take even more precaution than you might do for a normal, healthy 2-year-old dog who's, just happens to have a thick coat.
Great, thank you, doctor.
Wonderful. Anybody else? All right. Thanks so much, Bob. I really appreciate your spending your Saturday morning with us and getting that slide presentation together. Let's see, did you say you have an event? Oh, your event is tomorrow, right?
Yes. Yeah.
You're doing something with the Humane Society, so I hope that goes well.
Yep.
Give my best to your family and everybody. Thanks so much for joining us this morning. I'll stop recording and sign off.